really. Okay, so I'm going to start at the beginning, as I do with these talks. So traditionally, we have a data sharing practice for health and social care data in the UK. And what I mean by health and social care data is NHS health and social care data. So general practices, hospital trusts, and often social care data as well. And if you want to do a study using these types of data, often the researcher will have to propose a project. You then have to go and get specific project information governance, ethical and legal underpinnings for that project. And then you go to each of your data controllers. And if you want to do something using very specific hospital data that isn't available in a commissioning data set, such as hospital episode statistics, you'll need to go to 300 hospital trusts that are in England to get that data and get contracts with each of those hospitals and then get them to send you that data, where you compile it in your host organisation, you conduct the research in your host organisation. There are several issues with that, and I'm sure many of us who have used NHS health and social care data in the past can relay all of the struggles we've had in trying to access this. Firstly, from a patient perspective, this is very insecure. We are sending data to different people. It's being hosted in lots of different organisations, and there are very little controls over what analysis is done. We're expecting what the research proposes is going to be done for that project, but there's no audits or controls over that, or limited audits and controls. And then once that analysis or project has been completed, we don't know if that data is deleted from that host organisation or where it goes. It's hugely inefficient. I mean, I'm sure many of us can tell you how many years it has taken to get data. We're still trying to get data from NHS England for one project with the school infection survey that was done during COVID, and it's getting on for 4 years now to get that data. And I'm sure many of us can tell those types of stories. And often analysis is done within specific groups or teams, and it's not shared in a wider way. It's not open and often not reproducible. There have been several policy developments and national reports, including the Goldacre Review, Data Saves Lives, and I've not got the Sudlow Review, which came out late last year, that have all firstly highlighted the value of NHS health and social care data for patient benefit, but also the government is very much hoping that it will lead to growth, is the key word. But it's also, but the way we're currently doing it, using it for research, is really inefficient, insecure, and isn't effective. And so in 2022, the Department for Health and Social Care Social Care came out with a statement stating that secure data environments will be the default way NHS health and social care data will be analysed for research. And this means it will be expected that if you are doing an analysis or a project using hospital data, and this can be structured and unstructured data, primary care or social care data, it is expected that you will use a secure data environment to conduct your analysis, which has a lot of implications in terms of what we do now. There is a policy going in at the moment towards a data access route, and that's the legal gateway for this data to be used for research. But again, that is still being developed, and the implications of that have not been fully thought through, or what that pathway looks like. So what does the data access process look like? What does a secure data environment or trusted research environment look like? So here we have large platforms that have developed all of the information governance, ethical and legal processes to hold data for research and for in broad terms, so that research doesn't need to go for individual project level approvals from different organisations. There's one place that you do it, and there's a fully transparent process that is outlined, and often you go to a data access committee for that approval. So you propose a project, you get request approval from one advisory group, the Data Access Committee often, and then you access the data via a remote portal. You can't copy or download the data. Outputs are exported. They're often reviewed by an individual, as well as automated processes. And then once that's done, at the end of the project, access for that specific data is closed. And so in the UK in general, we have got plenty of examples of secure data environments that have been up and running for the past 10, 15 years. You have the Sale Data Bank in Wales, which is probably the oldest and most well established, that has health and non-health data for the population. And this is hosted by SERP. And then you have the Office for National Statistics, also has their remote desktop service. I forget what it's called now, but anyway, the SRS. And then Public Health Scotland has something similar as well. But we never, prior to the pandemic, there was never one for England for population-wide health and social care data. And that changed thanks to two big programmes of work. One was the NHS England Secure Data Environment. Second was Open Safely. The third was the UK Longitudinal Linkage Collaboration. I'm sure there were others as well, but those are the big ones. And then this led to the NHS England Data for R&D programme, proposing an interoperable network of secure data environments. So they have these three areas they want to focus on, this kind of population level. Repository focusing on Open Safely is focusing on primary care data, whilst the English Secure Data Environment has an extract of primary care data, but is thinking about other high-level data coverage, so hospital episode statistics, ONS, mortality data, specific disease audits. We also have a sub-national secure data environment programme. The one that is in the southwest, that in this area is the Southwest Secure Data Environment. We have Amy Dillon, who is the data access lead, who was here, but she's disappeared now. She's here today as well, and I'm the research lead for this programme, so I'll be discussing that with you. And then we have, as I mentioned, the UK Longitudinal Linkage Collaboration, which is bringing together longitudinal population cohorts and linking it to health and non-health data. And so I think, what is the best to do here? So I can do a bit of an overview of each of these. I can talk more about the Southwest Secure Data Environment, or I can talk more about the sort of future and what secure data environments potentially could mean for researchers in this room and have more of a discussion. I realise, I'm really sorry, Pal, but I recognise that a lot of people have heard this before, and I want to make it as most useful as possible. Is there any preferences? Okay. Well, I think that's very much would be an open discussion, but I would really like to hear everyone else's opinion, because I think this is where we're at the moment, and secure data environments cost a lot of money, and they cost quite a lot of money to set up, and it's a huge undertaking by one region to bring all of these data assets together, and there's lots of discussion around how best to do that. But I think the implications for researchers is actually quite large. So at the moment, people, I don't know if people use the Clinical Practice Research Data Link, CPRD. That is still on a data sharing practice, but we're moving towards a TRE, and the uncertainty that comes in this landscape, I think, does have means that researchers are in a difficult position as to what do you put in a grant, and how do you move forward. And part of my job with the Southwest Secure Data Environment as research lead is to highlight that secure data environments are best practice. It's what the government have said we should be doing, but the commitment from researchers and large research programs isn't trivial. And how we can do that as a group and large program and like a community, how best to do that, I think, is still up for debate. If I just carry on, would that be helpful? Okay. NHS England's secure data environment was set up in 2021, sorry, by the British Heart Foundation's Data Science Centre. It has an extract of primary care data that was extracted under the legislation that came out during COVID, called the COPE notice, and it was subsequently linked to hospital episode statistics data, ONS data, and specific COVID-19 data assets. So this was the first time an extract of primary care data was then linked to the whole of the English population. And it included comprehensive information on all health outcomes within the country over the time period of the pandemic. Over 57 million people's data was included in that repository. And the way it worked is we had the COVID Impact Consortium, which is a user community who accessed essentially a remote desktop and established sort of projects within that repository and developed pipelines for data curation and analysis. This required a lot of Zoom meetings during lockdown across, I think it was about 10 institutes. So at the moment you have over 400 members across 50 institutes, more than 70 analyses have been done, and I think that's probably 40 to 50 publications now. And if you go onto the BHF Data Science Centre now, there's a dashboard, so you can see all of the data that is available within this repository, including information on missingness and quality of the data. And we now include this maternity services data set. It has the ICNARC, which is the stroke disease audit. And it is a hugely valuable resource. And they did, the COVID Impact Consortium also consists of the Welsh, the SAIL data bank, and also the Scottish TRE as well. And so there has been whole population UK-wide analyses done. The Coalesce project did work on vaccination and COVID across 4 nations. And then you have Open Safely. Again, Ben Goldacre came to Bristol last week and he did his introduction to Open Safely. This is an open source tool-based system. I don't think he would like the term secure data environment, but essentially that is what it is. So he has a series of open tools where you develop curated data analysis, dummy data, where you develop and curate your code to complete your analysis, and then you push it to the data, and the data never leaves the GP software system, TPP, and all of the linkages, including the hospital episode statistics and ONS mortality data, are done by the software company, and you push code to the software company's data centers, runs the analysis, and you get the output from that. And all of the code, and this is all done through GitHub repositories and web pages, so everything is open and transparent. You can go to the jobs server, which is where you push these actions, they're called actions, your code to the data, and you can see every single output that has come out of Open Safely for each project. So fully transparent and very popular with patients and the public, and has NHS England support for non-COVID approvals, which is currently going through now. So again, they have over 150 projects, over 22 different organisations. They've got nearly 100 publications now. This has been a hugely productive endeavour. It was opened first. The first publication was in May 2020, And since then, they've published over 100 papers. They've had huge impact, especially during the pandemic, but going forward is now informing policy around winter pressures and things like that. And this is how it works. So you develop your code on dummy data. It is all synced via GitHub. You run it on Open Safely Jobs, and all of the aggregated results are viewed via a VPN. And again, with manual review, you get that outputted. How much longer have I got? Sorry. 5 minutes, cool. Okay. So, I've talked a little bit about the data already. So the NHS England Subnational Secure Data Environment, there are over 11 of them in the country. This program was established, again, funding came out in 2022, and they were established in 2023. And there's going to be 11 of them across the country. They're going to be focusing on detailed granular secondary care data. The idea is more real-time and linkages across non-health data that cannot be accessed in a standardised format with such as the commissioning data sets, is the idea. In the Southwest, we are a collaboration across 6 integrated care boards. There's 5 institutes, academic institutes. We have 1 ambulance service. I think there's 7 NHS trusts, over 350 primary care networks. It's a huge endeavour. And our progress to date, we have ethical approval. We have CAG and REC approval to receive patient-level identifiable data within the Southwest Secure Data Environment from NHS health and care providers across the region for linkage, and then making it available in a pseudonymised form for researchers. We have this hugely innovative data access model, which is agreed and signed up for by the 6 ICBs and the Ambulance Trust, which means that we won't have to go to each individual centre to get a formal approval for each project. It'll be hugely efficient. And we've procured our secure data environment, and will be being built to be up and running by spring this year. So we're doing a lot of an alignment at the moment in terms of with the NIHR infrastructure across the region, but also big program grants that are underway. So it's currently, for example, it's included in our Applied Research Collaboratives grant as well. And we are having further discussions about how we onboard more stakeholders, NHS data controllers going forward. The UK LLC, Andy's here and Emma's here, but I'm going to give an overview. It's got de-identified data from over 20 longitudinal population studies. It's got linked administrative data, so you have got NHS England that's going to be expanded to Wales and Scotland shortly. They've got Department for Work and Pensions and HMRC data, and with education data in the pipeline. 28 projects have been approved. There's over 50 potential users, and multiple universities have requested letters of support for onward grants. I'm just going to touch on this as well. Again, we talked about this in our last meeting, but around machine learning and AI methods. This is where everyone gets very excited. AI in healthcare. If we are going to do AI in healthcare, we're going to have to work out how to do this in a secure data environment. And we're doing this, we're starting to do this now. The National has a program called Foresight, the National Secure Data Environment, which is led by King's and UCL. They're developing a transformer model to predict next outcomes in COVID. DARE UK are also thinking about how to think about getting AI and machine learning models out of a secure data environment, obviously due to disclosure controls and risks. We're starting to think, we've got a project in the UK LLC, which is led by Charlotte James, and so we're starting to think about how we can do this and develop best practice. But again, there's lots of challenges in this field in terms of compute, skill set, information governance, the boring bit, disparate data sources, and the disclosure controls, this idea of safe models. And then, yes, so whittled through that. Apologies if a lot of you have heard this before. I hope that you found something new there. But